The en-bloc capsulectomy is a term that sort of originated in these support groups, in these online discussions about patients who are self-identifying as breast implant illness patients. And the thought process was that in order to cure breast implant illness, the implant has to be removed, but also the entire capsule has to be removed with the implant still inside, with the implant material still inside if the implant's ruptured, so that there's no contact with the implant with the rest of the body. This is not necessarily true, but this is what the breast implant illness community, the support networks really believed. And then basically because of that, a lot of surgeons were getting these requests, patient presenting and asking, the patient asking them basically, can you remove my implant and capsule en bloc? That presented a couple of different issues for us as surgeons, because the en bloc capsulectomy technically does not apply to the surgery. It's been used like that for a long time. But an en bloc capsulectomy, what that really means is, that comes from the world of cancer, the cancer surgery specifically. And what en bloc really means is that it is removal of surrounding tissue around the problem area in order to get the whole problem area out. So it's the appropriate discussion when in the context of cancer. Let me give you an extreme example. Like if you had pancreatic cancer, if a patient had pancreatic cancer, that is a very deadly cancer. And we know that the best chance of survival for a patient with pancreatic cancer is to take 5 centimeters of margin around the cancer itself, right? And that's the priority for that cancer surgeon, right? It doesn't matter what is in that 5 centimeters, because there's going to be a lot of collateral damage, because the pancreas is right in the center of the body. So it can be next to the colon, it's next to the liver, it's next to major vessels, it's next to the spine sometimes. And it doesn't matter. The surgeon will take all of those tissues and cut into all of them in order to get the cancer out, in order to give that patient the highest survival rate from pancreatic cancer. And then we'll deal with the collateral damage later. Now, obviously, when we're talking about implants, that may not necessarily apply in the same extent, right? So the en bloc procedure is more of a cancer term, but an implant isn't, as dangerous or as unpleasant as it is to the body, and it can have systemic effects, but it's still not cancer. So we should treat it slightly differently, I would say. So I think what the patients really meant is that when they were asking for an en bloc capsulectomy, is that they really would just wanted to get the entire capsule out, all the scar tissue associated with the implant, but minimize the collateral damage around that capsule. So if you talk about the patient to these patients about, is this the intent? They'll be like, yes, of course. Like, I don't want my muscle to be cut into. I don't want my breast tissue to be cut into. I don't want my chest wall to be cut into. I just want the capsule out, right? So the term for this didn't really exist, because this wasn't the surgery that was done. I mean, total capsulectomy is a term that's out there that plastic surgeons have used for decades that refers to removing the entire capsule. But there was not really a definition of like, yes, but the entire capsule all in one piece with the implant still inside. What do you call that? So recognizing the outcry of these support groups and all the breast implant illness communities and rallying around this term, the plastic surgery community has finally sort of responded, which I think is great, because it shows that's another example in the recent history that they're actually paying attention. But there was a sort of a consortium, the Breast Surgery Collaborative Community Consensus, which is kind of a copy that I have right here. And this is a consensus. It's a discussion between the American Society of Plastic Surgeons and the Aesthetic Society to sort of address these issues of terminology in this context. And one of the things that they've noticed is that the en bloc term is getting thrown around a lot, and it's used inappropriately and not in the context of cancer surgery. And it's being dictated into patient, operative reports by surgeons when it's being done, and it's just kind of misleading. So what they've done is they sort of agreed on the correct terminology. So the new term that they came up with for what my patients are asking for is actually a total intact capsulectomy, which makes perfect sense, because what we're going for is we are removing the entire capsule intact, as in the whole capsule is there, and the implant's still inside, and that's basically what that is. And we're trying to minimize the collateral damage to the surrounding structures to preserve the patient's function otherwise once the capsule was removed. So that is the term that the community has now agreed on as the appropriate term for what I'm really doing for the vast majority of my patients, what they're asking for. I'm still performing the same surgery that I used to perform. I'm just calling it something a little bit more technically appropriate. So that's the big term that they released. The other term that they released recently is basically a total capsulectomy or a total precise capsulectomy, which they define as complete removal of the breast implant capsule, but not necessarily done as a single unit or in one piece, which I also agree with. That's also something that I do pretty frequently. If I can't get the entire capsule out in one piece, but because let's say it's dangerous, let's say the capsule is sort of in the way of me seeing the anatomy very well, and there's a risk of me kind of cutting a little bit too deep and maybe going through the intercostal muscle and into the chest where the lung is, I don't want to do that. So occasionally what I'll do is I'll remove the vast majority of the capsule with the implant inside as one piece, and then there will be a small piece left over on the chest, which I will then go back for under direct visualization so that I can minimize the collateral damage to the surrounding structures under that one piece. But this way I can see it better once the implant's out of the way, once the capsule's out of the way, so I can be a lot more precise in this dissection. So that's what a total precise capsulectomy refers to in their terminology.